Hi, I am Aluisio Barros, Director of the International Center for Equity in Health based in Brazil. We assessed how coverage with key health interventions and their inequalities changed from the MDG period to the SDG period. We found good and bad news. Initially, using the composite coverage index, which is a weighted average of 8 interventions along the continuum of care, from reproductive to child health, we found clear evidence of a slowdown in the pace of progress. This slowdown was especially important in Eastern and Southern Africa. On the other hand, we found clear evidence that the inequalities between rich and poor reduced in most countries, but at a slower pace in the poorest countries. Using indicators that take into account quality of care, we found more good news. When you look at changes in the proportion of pregnant women with good antenatal care, most countries presented very good progress. All low-income countries improved the proportion of women with good antenatal care, as well as 80% of the lower middle-income countries. A maternal and neonatal indicator, which estimates the proportion of women who had 4 or more antenatal care visits, institutional delivery, and postnatal care for the mother or the baby, also presented very good progress. And finally, we assessed the proportion of C-sections among the poorest women in the countries. According to the WHO, we should have about 10% of women with a C-section, and this proportion was much lower in the poorest women and much higher among the richest. So, there is progress, but still a lot to be done, especially in the poorest countries and in sub-Saharan Africa. I hope you enjoy reading our report. Thank you.